Hi, everyone, and welcome to today's webinar. This is Coping with COVID-19 Response and Recovery. My name is Emily Grossman, and I direct the CBC Training Institute. We're so excited to have you all here today. And I'm going to just give you a little housekeeping information, which I'll also do at the end. And then we will turn it over to Jim. Jim Kennedy, who's from CUCS, who's going to be doing the training for us today. So first of all, if you are having any technological difficulties, please chat to the host. Our host today is Connor McCollum, and she is from the McSilver Institute, and she is here and wonderful, and she will help you with any of your technological issues. You may also notice that you are muted right now. We're not going to enable the unmute feature today, so you'll be muted, and we just wanted to let you know that in advance. In terms of the recording and the slides, if you would like the recording or the slides, we are going to have them up on the CBC website. So if you'd like that information, we're going to email you after the presentation with the link to view the slides and the PowerPoint. And also after the training, you're going to see, and I'll make this announcement again, we're going to send out a link to fill out the form to get CEUs. This training is offering CEUs, but just for LCSWs or LMSWs. So if you would like to receive a certificate for today's training, we will have you fill out the form at the end, and then it takes us a bit of time to process only because there's so many of you joining today. So I just wanted to let you know that information. Let's see. Due to the length of the presentation today, we are not going to be able to take question and answers. But I will, if you have any questions specifically for me, I will put my email address into the chat momentarily. I believe that is all. One more important thing, you must attend the full training in order to receive your CEUs. So with that, I'm going to turn it over to Deanna for a moment, Deanna Dober, who's going to talk a little bit about the SAMHSA grant that afforded us to do this training today.
Hi, good morning and welcome again. My name is Deanna Dobrea. I'm the Director of Preventive Care Management Initiatives at CBC, and I'm actually managing the SAMHSA grant, and the SAMHSA grant portion of it is specifically tailored for workforce, and so that's where all of these trainings are happening from. We look forward to having you participate in this training and in other trainings down the line as well. Thank you.
Thanks so much, Deanna. So again, my name is Emily Grossman. I direct the CBC Training Institute for those of you who have just joined. This is a joint project between SAMHSA, as we said, and Coordinated Behavioral Care, and Jim Kennedy is here from CUCS to do this wonderful training today. So just to tell you a little bit about CBC, we're a not-for-profit organization dedicated to improving the quality of care for New Yorkers with serious mental illness, chronic health conditions, and/or substance use disorders through a health home, an independent practice association, and other innovative programs such as preventative case management services. And we seek to create a healthcare environment where New Yorkers, especially those most impacted by social determinants of health, receive coordinated, individualized, and culturally competent community-based care that's effective in preventing and managing chronic physical and behavioral health conditions. We can go to the next slide. So I wanted to tell you a little bit about our training institute here at CBC. You'll see our mission statement on the top. We provide a wide array of different trainings for mental health providers, and you'll see some of our previous trainings from the last couple of months. This is a special series on self-care, and you'll notice that every month we're going to send out another announcement with more self-care trainings. These self-care trainings run between now, January, and August of 2021. So we're very, very excited to have you all here. Thank you so much for being a part of this. And I'm going to turn it over now to Jim Kennedy from CUCS to have him introduce himself and talk to you a little bit about self-care. And Jim, just make sure to unmute yourself.
Yes, thank you so much. Good morning and welcome. My name is James Kennedy. I go by Jim. I am from CUCS. And thank you for attending today, the Coping with COVID Response and Recovery. Just to let you know, at CUCS, we are on our social media. It's all listed here for you. Just to give you a little bit background, I am a licensed clinical social worker. I've been with CUCS for the past 20 years. And I'm going to do a little commercial for CUCS. I'll try and make it brief. The Center for Urban Community Services is a name that we have. Actually, there's a story behind that, of course, that we have kept the initials from when we started in 1979, and we were part of Columbia University. We started out because there was a group of social workers and social work interns. We love interns. And they actually were on 113th Street. They started to see a phenomenon in their park right next to them in Riverside Park. So if there, and I can tell you there was a lot of things going on in the 70s. So I'll tell you, it was homelessness. So if you see a phenomenon going on in your neighborhood, you can bet there is legislation somewhere connected to that. So we're going to go back even earlier, just because I like history. In 1963, yes, we're going to go all the way back to the 60s. There was a gentleman who had my last name. He was the president, John F. Kennedy, no relation. And he passed the Community Mental Health Act of 1963, which was really important for many reasons. Least of all, it was the first comprehensive legislative act that actually addressed mental illness in a much serious way. But it also deregulated all of the state hospitals across the nation. Now we're talking about the state of state hospitals in the 60s, which was pretty atrocious. If you think about it, we have very few psychotropic medications. Think Thorazine in huge copious amounts. People were in like what was known as a Thorazine haze, almost catatonic. And that made the places that were just warehousing people. They were ripe for abuses, including physical, emotional, and mental abuse. So by deregulating them, the thought was, and it was a good thought, take people out of these warehouses, put them back into their own communities, and hopefully the neighborhood mental health centers would pick up the slack. Unfortunately, it did not work out quite so well because they sort of lacked a backup system. So they would take people from, say, in New York, Bronx State, Rockland State, what's the one in Long Island? Pilgrim State. And they would put them on buses, and they would get, back then we didn't have Metro cards. Everybody was given a token, and they were told goodbye and good luck. So because of the lack of aftercare, throughout the 60s, 70s, and into the 80s, there was a huge rise in substance use. There was an incredible increase in incarcerations, and there was a huge, huge leap in homelessness. I tell this somewhat long story because at CUCS, our mission statement is to try and help end homelessness. And you see some of our resources here and some of our programs. We're mostly known for our housing, permanent, transitional. We have lots of things there. And the department I work with is not even listed here. So at the Institute, of which I am the program director of the training department, we actually train people, and we have been doing so for the last 35 years, but we use education as a way to try and go toward our mission statement. So if I was to ask everyone here, what is your agency's mission statement and what do you do to try and get there? Everyone would have an available answer. Yes? Well, hopefully it's yes, and hopefully you don't need to Google it to find out. So yes, we have shared our knowledge with several thousand direct care staff. So today, we are going to do an introduction to COVID-19 and stress. We're going to do a primer. We're going to talk about how our work is even more challenging and what's going on, helping our clients, tips to help, and then dealing with secondary stress. So we are jam-packed, yet fun-filled for today. So part of what we're going to do is identify sources of stress. We're going to actually do a baseline of what is stressful, and then develop awareness to the reactions and hopefully manage, cope, and understand increased stress due to COVID-19. So before we begin, I just want to do a big welcome and thank you for, number one, being an essential worker. We work in an industry that is unvalidated quite across the board. You hear lots about essential workers. You hardly ever hear about people in social work field being essential workers, but you are. And you are continuing to work on the front lines, and even a lot of cases, putting yourself at risk to help New York City's most vulnerable. So by doing that, you're accepting the increasing challenges to your work. And we recognize that those who are able to work from home also have increasing challenges. So we want to actually thank you for all of the work you do. We want to help you to actually remember to actually indulge in some self-care. And we applaud you, both CBC and CUCS applaud you for the work that you are doing. So there's a CNN review on stress and social work, and they show that 93% of social workers state their jobs are stressful. And workers actually feel great pressure to not make errors that can potentially do harm to service recipients. You are not alone. Just remember that, okay? But today we want you to go easy on yourself. Whatever you do today, let it be enough. So Hampshire also has a definition of stress, and it's the elevation in a person's state of arousal or residence, and it's caused by outside stimulus or demand. And as stress arousal increases, at the same time, health and performance actually can improve. However, once stress reaches its maximum effect, then the opposite happens. Loss and deterioration of health can begin. So a little primer. In the beginning, there were many unknowns about COVID-19 causing fears, anxiety, and stressors. And there was also a lot of miscommunication. Added to that were some economic woes, unemployment, health fears, and health fears have added to the enormous stresses of the pandemic. It's the first global pandemic in a century. So due to that, we're dealing with things we have never dealt with before. Social distancing, lockdown measures, although necessary for public health, they can also at the same time cause anxiety, cause isolation, loneliness, and even depression, all right? So the idea of us connecting with our clients and the treatment are all gravely compromised. So COVID-19 has made and is continuing to make our work even more challenging. And we have compounding stress. We're not just dealing with that. And it increases anxiety, all right? Going into the field is stressful, but at the same time, working from home, although you may seem to think it's lucky, it can have its own stresses. Staff with children going to school, being home, not getting outside as much, finding space, ways to connect. All of these are extremely challenging, and it goes against some of our basic instincts. And then we have fear. We have real fear, gut-wrenching, all-consuming fear, like the fear of dying from a horrific respiratory virus. And that can be much more powerful than science. So we move from business as usual to working remotely. And that's causing unique challenges. So learning Zoom, for instance, adapting telehealth, highlighting digital divide between staff and clients, even not having a computer, okay? And responding to a skyrocketing demand. So the staff is faced with a lot of technical and financial challenges they haven't had before. So even your travel has been compromised. Okay, so, sorry, I just did the opposite. I'm going the wrong way. And then added to all of this are some cultural and demographic issues that are related to and compound the stress that we feel. Some stresses are impacted by ethnicity. For example, police violence. 30% of Caucasian whites report as an issue of stress versus 71% of people of color. And income is linked to stress. Lower income people can experience higher stress rates. Although generally equal, studies show that women consistently report stress levels much more easily than men. Mothers are a large percentage of COVID-19 essential and frontline workers, and people of color more frequently identify and report common stresses, for example, financial stress. So we're going to do a little primer before we go on. These are some of the, I actually had on this Captain Obvious, okay, because we're actually in our 11th month of this COVID. So staying away from 6 feet away from people is now what's known as the new norm. Keep in-person interactions to less than 10 minutes if possible. Avoid indoor gatherings. Tis the season of indoor gatherings. Wear a mask, wash your hands, don't touch your face, and monitor your health daily. And then this cute little thing that I came up with. If you leave home, know your 3 W's. Wear a cloth mask. Wait 6 feet apart. Avoid close contact. And wash your hands or use hand sanitizer. All right, so now we're going to look at stress and the autonomy of stress. So this is sources of stress, and this is even before COVID. No time. How many people have actually identified with this? Got to go to the hospital. Pressure of deadlines. They don't pay me enough. Feeling unsupported. Feeling like you have to multitask. Even feeling sometimes nothing is working. Am I even helping? Another meeting could have been handled by an email. Help. More changes. Coworkers and their own personalities. When I first became a supervisor, the first thing I realized that didn't meet my expectations were the interplay of workers. Worker on client, we had down pretty good, but I wasn't ready for the amount of worker to worker problems. No one ever calls back. This is crazy. I feel like I have no control. Oh yeah, wait, another crisis. Time to get cursed out again. Paperwork, challenging clients. These are sources of stress even without COVID. And then you add COVID to that. And you start again, no time. Oh, I forgot my mask. Tell her what? Deadlines, they don't pay me enough. So everything that was there before has just been added to. Unsupported, multitasking. We're in a global pandemic. Am I even helping? I'm running out of options. Help. What was the policy for this? What's happening now? This is crazy. No control, loneliness, paperwork. What is the Zoom password? Pain and sadness. Seriously, again. So COVID has added to all of these that we actually had as a baseline before. I want to talk a little bit about some myths, okay? Stress is the same for everybody. It is not the same. People can go through something. One person handles it really well, the other person falls apart. Depends on coping mechanisms. And resources. Stress is always bad for you. No, there's a certain amount of stress that can actually help you to actually go forward, to actually push through. Getting a promotion can be stressful because it pushes you, but it's not always bad. Stress is everywhere. You can't do anything about it. We're going to actually talk about some tips that you can do because of that. The most popular techniques for reducing stress are the best ones. It's a big myth. The best ones are the ones that work for you. It's an individual. No symptoms, no stress. Big lie. You don't need symptoms to feel stressed. And only major symptoms of stress require attention. You got to pay attention to the little sources of stress because they add and they can actually sort of overwhelm someone. Questions? No, I'm not taking them. Sorry. Whoops. Impact of stress. Stress has the biggest impact when it's unrelieved. And COVID definitely feels that it fits into that category, even if we have a vaccination or two. Unexpressed, a lot of times people don't know how. Everyone is going through this together. So a lot of people don't know how to talk about or even in touch with the fact that they're feeling stressed. I'm not stressed, okay? And chronic. It just means it keeps coming. It feels overwhelming. All right. Stress, believe it or not, is part of our daily functioning, and it can manifest many different ways. Physically, somatically in your body, emotionally, liability in your mood, cognitively, or how you think, and then behaviorally, how you function. So the impact of long-term stress on health, okay, you can come up with cardiovascular disease, okay, demanding jobs, and we can put our jobs into demanding, okay, that category, that allow employees little control, increase the risk of cardiovascular disease. Multiskeletal disorders, and stress actually finds its way into the body, particularly the upper back and upper muscular disorders. Psychological disorders, differences in rates of mental health problems. Depression is a big one, and burnout is also in there. Suicide, cancers, ulcers, impaired immune function. Stress can actually kill, can give you a heart attack. Physical, rapid heart rate, muscle tension, trouble sleeping, problems eating, headaches, tremors. Emotions. Anxiety is the first and usually the biggest one. Anxiety can turn into fear, and fear can turn into anger. Frustration, becoming much more argumentative, irritable, sad, depressed, and difficulty sometimes even maintaining some kind of emotional balance. Your thinking, you can become disoriented. You can become confused. You can start having memory issues and some difficulty with some problem solving and even making some decisions. And then there is behavioral. So you can see that sometimes people actually misuse substances. In a study that was done, they found that by November, the use of alcohol for the year 2020 had increased by 500%. It actually does something about short-term stress. It relieves it. But we're looking here for something with long-term. And then behavioral unnecessary risk-taking. Okay, you can become bored and overwhelmed. You want some drama. You get into social conflicts. That's because that you have become irritable and argumentative. And then the opposite of that, you start to become withdrawn and start even isolating. So stress can have a huge impact on how we do our work and who we are as people. So we know there's differences between individuals. You know some people, same thing with drama, they seem to thrive in chaos, while other people get overwhelmed by even positive changes, all right? It's a highly subjective experience. And what you experience and I experience, we may both experience it, but in very, very different ways. And one of the definitions of stress is that it occurs when the perceived demands of the situation outweigh your own resources. So you're overwhelmed, okay? Therefore, the level of resources that you have available make a significant difference in whether someone experiences stress in a given situation and how deep that stress goes. You go from thriving, it's on a continuum, to in crisis. Thriving is, I got this, okay? You seem calm, you seem steady, you're able to take things as they come, you take things in stride, and you're pretty consistent. And it's not really impacting your normal sleep patterns and your appetite. Then you go to surviving, where something isn't right, all right? You start to take on a little anxiety, a little nervousness, increased mood fluctuation, even sadness. And you can see that your performance, especially at work, becomes inconsistent, easily overwhelmed or irritated. And you start to have a little bit of trouble sleeping and or eating, okay? Struggling, I can't keep this up. You start to have persistent anxiety, which can lead to fear, can lead to panic, being overtired all the time, exhaustion, leading to poor performance and difficulty making decisions. You start to get those aches and pains and feeling fatigued to the point where you can become in crisis. I can't survive this. Your loss of function, you become disabling. The distress is overwhelming. You start to experience panic attacks, very easily enraged or even aggressive, and unable to fall or stay asleep. So you see that stress can create this continuum of which we go back and forth on. And you can actually do that in a day. So how do we help ourselves cope? All right, we're all in a stress response right now. And when the survival gear is up, your cognitive functions can change. Your ability to think clearly becomes cloudy. It becomes different. You're not so sure. This is the territory of where it goes into trauma, and it's no one's fault. As a result, we can't can't integrate what's happening, even if we haven't noticed a challenge in our processing. The integration doesn't happen until later. Right now, you're just in the event. You're in the trauma. Welcome to the new normal. Right now, all of these things can feel normal. Feeling numb, feeling anxious, feeling on high alert, okay, feeling collapsed, feeling depressed. They're all normal. even feeling clingy or impulsive, paranoid, just nonchalant. These are all normal. Reaching for addictions can be considered normal, especially at this time. We've lost our footing. So one of the things is, number one, meet yourself with compassion. Seeing a range of responses in yourself at different times of the day, it's also consistent with being in an active stress response. So you can even enjoy certain experiences you're having while other parts of you are overwhelmed. Okay, we can block things and we can put them into different situations. We're complicated beings. Many parts sit side by side. And because the trauma is happening still, the goal of meeting yourself and all your coping mechanisms with compassion, that is the goal. Meet yourself with compassion again and again. Learn how to throw some flowers at yourself. Learning how to be a little kind with yourself. Most of us at our job, whether you're going into the office, whether you're working from home, the job is really taking care of people. Even if you're doing progress notes, you're still taking care of people, which is so important, okay? Then when you're at home and not working, most of us take care of somebody else. You have something else to do. So sometimes we don't get a chance to put ourselves on the list of things to take care of. A lot of people don't. So making sure that you take time, even if you have to actually stop and remember to take time, eat lunch every day, make sure you take a break. If it's warm enough and sunny enough, get outside, do something to actually take care of yourself. Even little things can be actually turned into bigger things. But because most of us pre-COVID didn't even actually function in a way that we learned how to take care of ourselves, it's so important right now to put that on the list, to put yourself on the list of things to take care of. If you can, start to change some external stressors. Be more assertive about your needs. Ask for clarity of priorities. Be assertive about clients wearing masks. Be assertive about yourself wearing masks. Advocate for yourself to work remotely when you're feeling overburdened. Advocate for yourself to actually learn how to take care of yourself. We do this for our consumers. Some of us have to learn how to do it for ourselves. Sometimes it's just as easy as reorganizing your time, sitting down and taking the time to reorganize what priorities are. Look at your career path, reevaluate what's important day by day. And having some good time management techniques can really turn into a lifelong ideation that you can have. See what you can change physically and emotionally because they're so connected. Try and practice how to turn off work when you go home. Remain empathetic. Okay, it's very easy when we get irritated and lost to lose some empathy. Just remember, everyone at some point is lost and or afraid. Concentrate on what the important stuff is, and then concentrating finding out what is important. What's important to you? What's important to your clients? And concentrate on that stuff. Alter your perfectionist attitude. I know a lot of people who are not happy unless what they perceive is perfect. And nothing in life is perfect. So try and make sure that someone is feeling relieved, someone is feeling a little better, you touch someone's life in some way. Do that with yourself also. Some of the easy stuff, or for some of us, not so easy, but easy to say, exercise and eat properly and get sufficient sleep. This is a time of really learning how to take care of you, decided by you and headed by you. All right, we're going to actually go over some tips that actually work. When this first happened, especially in my division, I am the least technical person that I know. I can get very overwhelmed by that. But learning Zoom, and we would actually practice, and we would have team members, all of us took turns being the host, learning different things in Zoom. The same thing with telehealth, learning something. There were several people who were a whiz at this. Make sure that if you can ask and advocate for staggering shifts. Things get much more complicated. We know that some people with families, school has worked, school has not worked, school is in session, school is not in session. So seeing if you can actually advocate for staggering shifts. Make sure that your workload is in line with your capabilities and resources. You may get asked to do things. If you don't have resources, you won't be able to, so ask. If you don't know how, make sure you advocate for yourself. I need to learn how to do that, okay? And make sure that you clearly define what your role and responsibilities are, okay? If there are new policies and procedures at CECS, we have them all the time for COVID-19. Make sure that you know what they are. Make sure that in team meetings, you are going over them. Make sure the responsibilities are clear and understandable. And being flexible, okay, with staff time, asking for some flexibility with your time, okay? Children are going to school, not going from school. Sometimes you need to actually be there with them. Other things may come up. And take into respect that there are sometimes people really want to talk about this, and to respect that. And then also respect at a certain point, people don't want to talk about this. As long as they are talking somewhat and not totally isolating, you have to learn how to respect not talking about it, okay? All right, so as we are all in some kind of trauma or possible trauma, you know that for generations to come, we're going to have some, we're going to have to be trauma informed. If not now, you need to make sure that that's on the list of things. And then to realize that grieving is normal following trauma. You are going to grieve for whatever losses have occurred. Loss of freedom, loss of individuality, loss of faith that the world is safe. Whether or not a traumatic event involves death, survivors must cope with the loss, even at the least of their sense of safety, especially with COVID-19. And the natural reaction to this loss is grief. And then, like people who've lost a loved one, trauma survivors go through a grieving process. And make sure that you are being supported through this process. And you're going to find this easier to cope with if you have other people to turn to for support and you learn the steps of taking care of yourself. Very important. Try not to do this alone. Ask for support when you can. And for a lot of people, that just asking for support is a big, big step. And then learning to take care of yourself is another, especially in this field where we take care of other people. Those two things can be a big leap when you have been the one that other people come to for support. All right, other tips. Number one, get moving, okay? Trauma disrupts your body's natural equilibrium. So you get stuck, you get frozen in this hyperarousal and fear. In essence, your nervous system gets stuck, and as well as burning off adrenaline and releasing endorphins, exercise and movement can actually help your nervous system become unstuck. Even walking, some kind of movement, getting up, getting out, changing your environment can actually do a lot of good. Number two, don't isolate. Participate in social activities, even if you don't like it on Zoom. Do whatever we were with normal. I love the word normal. It's a function on a washing machine. So do what you have been doing with other people if you have to do it on Zoom. Lunch dates, happy hour, ugly sweater party. CSS, we even had that. Things that you used to do, you can do them. It's not quite the same, but it does feel good. We actually then had somewhat of a discussion after we did it. And everybody actually felt better after doing this. All right. Make sure that you're regulating your nervous system. So there are many things that you can do. Mindful breathing, okay? If you're feeling disoriented, confused, or even upset, a very easy and quick way to calm yourself is through mindful breathing. Simply take 60 breaths, focus your attention on each out breath. So we're going to do that right now. We're going to actually do a little mindful breathing because it is the basis of all other things, all right? So I want you to actually sit in your chair, back straight, feet firmly planted in front of you, and your hands on your belly in front of you. We're going to actually do just 5 of these, not 60, because we don't have a lot of time. But what I'd like you to do is to close your eyes if you can. If you can't, just look down. And I want you to actually think about your breath. And we are going to breathe in through the nose for a count of 3, and then slowly breathe out for a count of 4. I want the breathing out to be longer, and I want it to be like you're blowing out a candle on a birthday cake. So let's practice 2, and then we'll do 5. All right. So breathe in, 2, 3, slowly push it out, 2, 3, 4. Breathe in, 2, 3 through the nose, out, 2, 3, 4. All right, concentrate your mind on just relaxing and paying attention to the breathing, making sure you can actually close your eyes and see the breath going in through your nose and then out through your mouth. One of the things that I used to like is doing it with color. You can do this if you choose to or not. Breathing in with a fresh, bright, minty air. So I would breathe in with white, bringing it in crystal clear, icy breath, and then out with red hot going out. So let's try 5 of these, okay? And I'm going to let you do these yourselves. You can talk to yourselves. So take a moment and let's do 5 mindful breaths. Take a moment, coming back, taking those breaths. And if you actually try, I mean, Everything that you do from there, all of the things that we do, being grounded, mindfulness exercises, they all start with breathing. And sometimes we can get so caught up with things that we forget that we're not breathing. I know for me, I sometimes hold my breath when I get tense. Another thing is staying grounded, to feel in the present and feel more grounded, okay? Sit on a chair. You can do this right now with me. Feel your feet on the ground and your back against the chair. Look around you, pick 6 objects that have red or blue in them. Notice how your breathing gets deeper and calmer. So to start this, you start with the breathing in the same position. Then you pick 6 objects that have red or blue in them. And you notice how your breathing can get deeper and calmer. So let's try this for a moment. We're going to try the deep breaths. We're going to try 5. And then you're going to pick 5 or 6 objects that have red or blue in them. And you're still going to do the breathing. So close your eyes and start the breathing. Even if you didn't finish them, we need to go on. But these are some self-regulation that you can help your nervous system by just slowing things down, really staying focused, just concentrating on the breathing, slowing your breathing down. And you get deeper and calmer as you practice, even if they feel a little dumb. I know when I first did these, I felt like giggling to myself, but they really, really do have an impact on you. All right. You know, once again, remember to breathe, sleep, avoid alcohol and drugs, diet, reducing stress, breathing, schedule time for activities that bring you joy. And I don't mean just Netflix, just breathe. Okay, so unfortunately, there are times when what we expect is overshadowed by the stressors at work. So we're going to talk a little bit about compassion fatigue. And it's when it gets diminished, it impacts your way of functioning so that you can be an empathetic and compassionate helper. And in this field, we need so much compassion. Trying to put yourself in someone else's shoes and understand their point of view is really what this job is all about. So when that is compromised, when you're feeling tired and overwhelmed yourself, you can actually go to the point where you have compassion fatigue. It's also known as secondary traumatic stress disorder. And this is common among victims of trauma and individuals that work directly with victims of trauma. So working with someone who's homeless, working with someone who has been homeless, working with someone who's gone through periods of unemployment, homelessness, having a severe physical ailment, HIV, diabetes, lupus. Any of those things can be traumatic in themselves. And then dealing with some of the added things that are going on in this country today. Watching the news can be informative and yet at the same time overwhelmingly stressful. So you want to remember that compassion fatigue or secondary trauma stress disorder is a real thing. So some of the signs: fear in situations that normally wouldn't be frightening. excessive worry that something bad is going to happen to you or loved ones. Feeling on edge, having you feel almost manic, where you're easily startled and you're jumpy and you're always on guard. That takes a lot of energy. You start to get wary of every situation, expecting a traumatic outcome. And then somatically, you're going to start to have physical signs like a racing heart. You're feeling shortness of breath, headaches, panic attacks, feeling that others' traumas is yours. These are very, very easily to actually bring you in there. One of the signs of burnout, okay, thinking about your work all the time, difficulty concentrating, difficulty in remembering things that you're supposed to do, feeling exhausted, fatigued, low energy, which is low productivity. Increased periods of illness, you're going to feel it in your body, more headaches, more backaches, more stomach aches. You're depressed, sad, irritable, angry. You're going to feel like isolating, and your vision of what's going to happen becomes much more pessimistic and cynical. All right, so you chopped off half of your finger. You still have half left. So what? All right, cynical. You start to become. There's a shift in your diet, poor lunch and eating, and trouble sleeping. And some people then start to turn to self-medicating, alcohol and drugs. I worked on the Upper East Side of Harlem, and from 116th Street to 125th on 3rd Avenue, there were 11 liquor stores. So alcohol is one of the things that is, first of all, socially acceptable, and second of all, relatively inexpensive. And our society actually encourages. What do you do on New Year's? We toast with champagne. What do you do at a wedding? You toast with champagne. You drink, okay? Most people will drink before they're the legal age. And in our society, we actually sometimes encourage that. I remember growing up in my family, I started drinking at 8 months old. I was teething, and my mother rubbed alcohol on the sore spots. So just think about that, and think about how easily that is to try and self-medicate, because it's something that as a society we encourage. Vicarious trauma. A worker can experience both vicarious trauma and burnout, and each has its own remedies. Now, vicarious trauma is something that really, really has to deal with intense feelings, intense motion. The number one job that has the highest level of vicarious trauma is actually nurses that work in a burn unit in a hospital, because the way to actually stimulate the healing process with skin is to scrape it off. So while you're actually providing care, you're actually also providing pain. So that is something that comes up a lot in a nursing unit dealing with burn victims. So the symptoms are similar to PTSD. So withdrawal, intrusive imagery, numbness, nightmares, sleeping and eating problems, core beliefs about people and the world start to shift. So one of the things to do is to keep caseloads manageable and as diverse whenever possible. To try and maintain safety and security systems. Develop coping skills. Do what you love. Find a way to throw flowers on yourself every day. Take vacations. The amount of vacation time that is available that people don't take is astounding. Make sure you are taking a vacation, even if it's a staycation. A team approach can help workers feel like they're being supported. And finally, COVID-19 has forced us to adapt in ways that are not always ideal for both the provider and the client. It's clear that this is unprecedented, and we are rising to the challenge to meet the needs of our population as it unfolds. Stress and anxiety have a negative effect, and they may have a negative effect once they're too much. And in the world today, they seem to be at that level. And they impact our daily lives, and they impact our job duties, okay? Remembering that self-care is vital, okay? Learning how to take care of yourself, taking a walk, taking a stretch, giving yourself time to decompose, taking a walk outside, finding a new hobby, learning things about something can definitely help. Develop and implement self-care plans. So make sure that you are actually trying to put that in for yourself. Make sure even after COVID passes that you take lunch every day. And by taking lunch, I don't mean sitting at your desk and just going over things. It means getting up and going outside. It means really understanding what's going on. There is light at the end of the tunnel. Right now, currently, we have 2 vaccines, and the vaccines are actually, although slowly rolling out, they are rolling out. You're seeing more and more people getting them. But for us, even though this is for some people a year, some people 11 months, the next 2 months are vital. So please, please make sure you are being vigilant about staying safe and about staying healthy and doing all those things that we've gone over. Wearing masks, keep social distancing, washing your hands, all of those basic things for the next 2 to 3 months are going to be imperative because people are dying in the United States. We have over 350,000 people who have died of COVID-19. So with the advent of these two vaccines, there is hope, there is light at the end of the tunnel. So please be sure that you are taking one thing at a time and you are putting some self-care into your system. This is Dr. Anthony Fauci and saying, we've got to hang in there together and we've got to learn how to take care of each other. It will end. These are some of the rollout of the vaccines. So we're even actually expecting Johnson & Johnson to have their rollout again next month. So there is a lot of help on the way. Here is a resource for New York City Well, talk, text, chat 24/7. And there is the number and there is the webline. Okay. Final thoughts that it's important that we learn self-care. It is important that we actually make sure that we are being diligent about the ways to take care of ourselves, but that this can be a positive change because it can be long-term. Even with all of the damage that's come out of this, we can still actually be optimistic about going forward. With that said, I got this done a little bit earlier than I thought I would. So I'm going to put Emily on at this point.
Okay, thank you so much, Jim, for that very important training. I know I got a lot out of it, and I hope others did as well. So a few housekeeping things for those of you who joined on the later side. We will have the slides and the recording emailed to all of you, the link for it. It's going to be on the CBC website. And so we're going to send out an email with the link to all attendees. We are, excuse me, going to be now putting the link to the survey. If you are an LCSW or LMSW, you can get CEU credits, and this is where to go for it. I have also put CEUs at cbcare.org if you have further questions for us. So thank you so much for joining today, and I hope you all have a wonderful day.